Hi, everyone. I'm Kate Lester. I am the person who is the main administrator for COVID by numbers, and I'm a health geographer at UNT. Lately, I've had a lot of people come to me concerned about a growing or very vocal move towards herd immunity strategies to deal with COVID-19. And I started putting together something to explain why I don't think that herd immunity is where we should be putting our faith. And it's pretty complicated. So it's more than really I could do in a Facebook post. So I made a video, just like I do for my students. So the first thing we need to do is understand what immunity is. Okay, immunity is the ability of an organism to resist an infection because your immune system, your antibodies and white blood cells have become capable of fighting it off. Okay, so that's basically the idea. If you have immunity, either you're not going to get sick or your symptoms are going to be less, but it's partial immunity because your body already knows somewhat how to fight it. So there are two ways that you can get immunity in general. One is often when you recover from a disease, you develop antibodies or teach your white blood cells how to attack that particular pathogen. And that doesn't always happen, but often it happens. That's why you saw things like chickenpox parties back when I was a kid, because if you got it, you recovered from it, then you didn't have to worry about it anymore. And the other way is through immunization, and this is what we've been moving towards in the modern world. The modern project has been a project of immunization, right? Measles, mumps, rubella, flu, chickenpox now, all kinds of things, polio. All right, so the vaccine, there are many different kinds of vaccines. Some use pieces of the disease itself. Some use antibodies towards that disease. Some use RNA. There are all kinds of different things. That's why there are so many different projects to get COVID vaccines off the ground. So these vaccines don't really get you sick. What they're doing is they're trying to give your immune system a blueprint to fight off the disease when it comes into your system. And we have eradicated one disease off the face of the planet. Okay, using herd immunity strategies, and that's smallpox, okay? So from this graph, you can see that from 1920 to 1980, the cases of smallpox, you would have outbreaks, but generally they went down until around 1980, we declared smallpox eradicated. How did you do that? Did it through vaccines, strict quarantine, and contact tracing during these outbreaks, okay? If you get the population vaccinated to a certain level, then at least you can identify outbreaks and only deal with that. Right now we're dealing with basically the entire population going through outbreaks, and there's really not a way to control that. So right now one of the big questions is, does recovering from COVID give you immunity to COVID? And the answer right now is maybe, okay? We don't know a lot about immunity to coronaviruses. A lot of the coronavirus research has been on SARS and MERS, Middle Eastern Respiratory Syndrome. The problem is when those outbreaks stopped, the funding all disappeared. And so there has not been the kind of extensive research on these diseases that there needed to be. Coronaviruses are new. We really think they only started coming into humans in the 1950s. Okay, so COVID is from 2019. Coronavirus, the family it belongs to, has only been around in humans for about 70 years. And that means that our immune systems haven't necessarily developed the appropriate equipment to deal with the coronavirus. We don't have natural selection like we do for things like, well, frankly, the plague. When you have a long history of people living with the disease, we have more resistance to it. We just don't really know. We don't really have a lot of experience with coronaviruses. The other thing is, not all diseases bestow immunity. This has been confusing to me, people acting like if you get a disease, you get immunity from it. Hopefully you guys know that that doesn't work with most STDs. If you get it once and you clear it up, you can still get it again. Rhinovirus is another example. Rhinovirus is one of the things that causes the common cold. You don't get immunity to a rhinovirus because your immune system is always trying to attack the wrong part of the rhinovirus. So you can defeat it, you can expel it, but you don't actually have the instructions for how to defeat the virus because your immune system never learned how to defeat the virus. And so you can get rhinovirus over and over and over and over. That's kind of the fear, right? We just don't really know what kind of lasting immunity we have. And there's new research this week that came out of Spain, but it's been coming out of other areas that are hard hit as well, that your antibody level decays rapidly when you do recover from COVID. That's somewhat concerning. It's not really clear, okay, do you need the antibodies in the system, or does your system now have the instructions for making those if you get sick again? But it's not great. And this is leading a lot of epidemiologists to say herd immunity is not a reasonable goal. It's not a thing that's going to happen naturally, which makes sense, you guys. I mean, if it was common that a disease went through the population, granted, bestowed herd immunity, and then it wasn't a problem anymore, why would we have vaccines for all of these 1,000-year-old diseases, right? It's a shaky premise to begin with. And here's the other thing that's coming out now is that if you don't have a severe case of COVID, your system might not be mounting a strong enough attack to actually learn how to fight the disease. So in people who had more mild or asymptomatic cases, we're not seeing their antibodies response where we would like it, okay? So in addition to that, if we have multiple strains of COVID develop, which isn't uncommon with diseases, we'll talk about that in a minute, but if you have multiple strains of COVID develop, fighting one off might not make you immune to another, okay? So that's very common with dengue, with the flu. There are a lot of viruses that work like that, where you can fight off one strain of it and then get hit with another one. And often, like with dengue, the more strains you get, the worse your complications get. So there's good news, okay? So even if our bodies aren't producing lasting immune responses, there are ways that they can engineer vaccines to do that for us. So vaccines can give us a stronger immune boost than our own bodies. So this doesn't mean that, there's no hope, right? There's no vaccine, there's nothing that can be done. So we are very much waiting on a vaccine. So that's all about within yourself. Now, what's herd immunity? Herd immunity is at a larger scale, right? These are population level dynamics. And so the idea is that with herd immunity, enough of the population is immune that if I'm sick, I have a low probability of coming in contact with somebody who is susceptible to the disease, who does not have immunity. Okay? It's a probabilities game. Herd immunity does not mean that the disease disappears. There's only one disease on the planet that we believe we've eradicated, that's smallpox, and that's way beyond herd immunity, okay? But herd immunity is the point at which the spread of the disease slows dramatically because you're interacting with fewer people who are vulnerable. And herd immunity has a lot to do with how contagious the disease is, okay? So measles, most contagious disease that we really have to deal with. And we need 94% of the population to be immune. So in places where people have stopped vaccinating their children, even just a few, right? So in California, where the herd immunity level or the immunity level is down in the 80%, we're seeing measles outbreaks again because they have gone past that threshold. They are now vulnerable to outbreaks. So COVID, we don't think is as high. We think probably we need about 70% of people to be immune for the spread to slow down. We're nowhere near that. Nowhere near that. It's a fringe belief that, half the people have had it. That's almost certainly not true. So here's how it works. If I get sick, and by the way, my assumptions in these models are that while I'm contagious, I interact with 3 people, close enough that they could possibly get my disease, okay? So in the first situation, no one has immunity. All 3 of the people that I interact with are susceptible to catching COVID. So that means that all 3 get exposed, and the disease has opportunity to move on to a new host. And of course, these people then take it on and move it on to new hosts, and that's how disease spread works. But as more people get immunity, there are fewer chances for that disease to spread, okay? So if one of the people has immunity, right, only 2 become, infected or exposed. And the idea is once we get to herd immunity, the chances are very high that everybody that I come in contact with has immunity. The disease can't spread on from me, and so it just dies out, and that's the end of the line. That is our goal. That is our goal with vaccines, and that is the goal of people who want to let the disease just kind of run wild until we achieve natural herd immunity. So again, we're keeping my assumption that people come in contact with 3 people while contagious. So here's kind of how herd immunity logic works. So our blue line is the proportion of people with immunity, all right? So at the bottom, no one has immunity. At the top, everybody's become immune to COVID or whatever the disease is, okay? The red line is the probability that me as an infected individual is going to have someone who is susceptible to COVID in that 3-person bubble, all right? So as you see, it's not a straight line. It's an exponential line, and so the level has to be pretty high. Currently, they're saying about 70% before it starts dropping, okay? So 70%, again, does not mean that the disease stops. It means that the disease slows down. But as you can see, even in this model, once 90% of the population is immune, I still have a 30% chance of coming in contact with someone who is susceptible to COVID, okay? So it doesn't mean that the disease stops. It means that it slows down, which slowing down is good because we're overwhelming things. But we do have to have a lot of people with immunity before this starts. And again, this only works if people can't get it again. If you don't have a lasting immunity, then this chart doesn't work, okay? And this line will never really come down. So, I want to really quick talk about the risks of taking a herd immunity public health strategy, okay? Of saying, oh, well, what we're going to do is we're just going to let the disease spread. We're going to let it get into wherever it needs to go. We're going to let it kill a bunch of people because, that then we can go back to normal. This is kind of the idea that I think people have is that, oh, if we just let it run wild, then we can go back to normal as fast as possible. There is no normal to go back to. COVID will be a problem for the rest of our lives, okay, in one way or another. Hopefully we get a vaccine and we only have to deal with it in outbreaks, but this isn't a thing that is going away quickly. And let's talk about why this approach has now been deemed unacceptable, unethical, and useless by most of the scientific community. So first of all, a lot of people will die. Full stop, a lot of people will die if you just let it run wild, okay? So if 70% of the population has to be immune, and we're talking about catching the virus, not vaccines, and only 0.5% to 1% of infected people die, okay? So the kind of accepted value is 1%, but I'm saying even if it's 0.5%, we get a lot better at treating COVID, which we do seem to be getting better at treating it, and we keep all of our old people locked away for 2 years or whatever, and it's only 0.5% of people who die, which this is a number that I see people constantly act like, well, that's nothing. That's nothing. Well, with those numbers, what happens is that we have between 100 and 200,000 Texans who die from COVID. Okay, in Denton County, we have between 3,000 and 6,000 people who will die of COVID. And in our little city alone, we're looking at almost 1,000 deaths. So this is what people are saying is acceptable when they say that a herd immunity strategy is what they're advocating. Okay. First, just a bunch of dead people. And no, deaths are not currently stable. No, it's not that the second wave people aren't dying. There is a time lag, but also if you look at the data, twice as many people are dying per day now as were a month ago. So no, deaths are not stable. We now have 40 Texans per day dying on average as opposed to 20 less than 30 days ago. Deaths are going up. This is happening now. This is happening. So the second effect is going to be that hospitals and medical staff are easily overwhelmed. Okay, we've seen it over and 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 over. We've seen it in Europe, we've seen it in China, we've seen it in New York, we've seen it in Florida, we're seeing it in Houston. This is happening, okay? And it has nothing to do with how good our medical centers are, how great our medical staff are. COVID is a sneaky bitch. So it has weeks of lag time. And what I'm seeing now, and I'm really worried about, is that we are not intervening until hospitals are completely overwhelmed. But if you do that, then you can expect to have 3 to 4 more weeks after you shut down where things will keep escalating in the hospitals. Because you have about a week or two, usually, before you have symptoms to complications, and then from complications to death is another several weeks. And so people become complacent until it's much too late to intervene. And the wheels are off, the brakes are off, and it just escalates. It just gets way out of control. And I'm very concerned that we're allowing that to happen. Typo. But shortages of supplies and medications, that's a thing that happens when everybody goes to the hospital at once. So this isn't just for COVID. This is everything. You don't have gloves. You don't have gauze. You don't have ibuprofen, right? You're running out of everything because there's a huge rush on the hospital, and we just don't have the capacity for that, okay? Nurses and doctors are people too. They also get sick. If you have a giant push of people with COVID into the hospitals, your nurses and doctors are going to get sick too, and we are seeing that happen. Now your staff is down, and you have even less people to provide services. And by the way, nurses and doctors get traumatized. Some of the people who worked through New York, through that epidemic, have quit their jobs because they see it happening again, and they refuse to go through it again. So I don't know why it's acceptable to put that kind of burden on our healthcare professionals. When hospitals get overwhelmed, fewer people can get the best treatment, so you're going to see a higher proportion of people have serious complications and die. That's just how it is. If you're not in an ICU, instead you're in a field hospital, you're just not going to get the same level of care, and that has nothing to do, again, with how dedicated our nurses and doctors are. That just has to do with field medicine. I think that's pretty obvious. So people who need the hospital for something else are going to be more vulnerable to catching COVID the more people you have in your hospitals with COVID. So currently in Denton, we are up to about 13% of the people in the hospitals have COVID, no matter what they came in for initially. The higher the proportion of that, the harder it is to keep from cross-contamination. And now you've got grandma who had a slip and fall, comes into the hospital and catches COVID just from the hospital. It's called iatrogenic disease. So that will then hasten the spread of COVID into vulnerable populations, which again will up the death toll. 3, even when people don't die, medical debt will skyrocket to catastrophic levels if we let this run through 70% of our population. So there have been several cases where people have gotten their bills for long stays in the hospital, and they were anywhere from $400,000 over $1 million. So this man in Seattle received a $1.1 million bill. Now, luckily he has insurance that's going to cover most of it. He is responsible for $6,000. For some of you, I know that the difference between $6,000 and $1 million is not that big. And for others, like the 25% of people in the 20 to 29 age group who do not have health insurance, I don't know. So the thing I want you to recognize is when we're talking about survival, we're talking about people paying $10,000 a day to be in the ICU, $3,000 a day to be on a ventilator, and then just about $500,000 worth of other sundry expenses. Look, what are we going to do? You know, half of the people who are homeless are there for medical debt, and that's before COVID. This is the kind of thing that changes complete economic systems. And I don't know. I don't understand why this is okay. Why allowing so many people to go into medical debt is going to be good for the economy, is going to be good for individuals, is good for society. I don't know who it's good for. So it's not just, oh, I get super duper sick and it's super expensive. So we're seeing that the lack of tests available is also expensive. So you're having chest pains and you have a fever and you go to the emergency room and they don't have a COVID test. Well, the COVID test would be free to you if you have insurance, $100 if you don't have insurance. But because they don't have a COVID test, they're running EKGs, they're doing lung scans, they're doing all kinds of things. And now you have a $5,000 emergency room bill. And you just have COVID, okay? So this is another thing that people are reporting back that, oh my God, there's so much money. We're also going to see increased medical debt because people are delaying care for other issues. They're not going in and getting preventative care. They're not going in for minor issues. They're afraid of COVID because our hospitals are now full of COVID. And so your bills are going to be higher the longer you delay care and the more intense care you need later down the road. And I don't think we can underestimate how bad a pandemic situation, especially the kind of pandemic that overruns hospitals, is for mental health. People with existing mental health conditions are struggling. We know that COVID, one of the things that it can do is trigger new mental health issues. But beyond that, I used to work in disaster mental health, and you'd be surprised at how widespread trauma is after a disaster event. So the only requirements, really, what PTSD is you feel like your life's in danger and you feel like you can't escape. And that can traumatize you to the point of having all kinds of problems for a very long time, maybe the rest of your life. And we know that we see with hurricanes, children who go through hurricanes, about half of them have serious trauma issues, about a third of adults. And the thing I want you to remember is a hurricane's over in a couple of days. This is going to go for weeks and weeks. And I don't think we really understand how bad this is going to be for the psychology of our country. And frankly, for things like following laws, trusting the government. I mean, that's the kind of societal fall apart that we see all the time with pandemics. From the Black Death all the way to Ebola, we see society start to collapse when they realize that their death is considered acceptable collateral, right? 4, COVID is likely to create a wave of disability. So even if the deaths weren't escalating, I can't believe how often I hear this. Oh, as long as people aren't dying, who cares? We're going to see a wave of disability, which is going to be expensive. And frankly, just why would you want people's quality of life to be worse than it is? That's cruel. So the fewer people get COVID, the fewer people who are going to have COVID-related issues like amputations, lung damage, strokes, all kinds of problems that will be with you for the rest of your life in a lot of cases. But here's the other thing. All the other people who need the hospitals for things other than COVID are also going to get worse treatment than they would have otherwise. So you're going to get escalating disability bills for people who would come in for traffic accidents, heart attacks, childbirth, normal things, who can't get access to the resources they need because the hospitals are swamped with COVID. Here's the other thing. COVID mutates, and it already has mutated a couple of times. Right now, the mutations seem to have made it more contagious, but not more deadly, and they haven't mutated to the point where we don't think vaccines will work, But the more a virus replicates, the more mutations can occur. That's just how it works. So the more people it infects, the more chances there are for advantageous mutations to arise. If you let the virus run wild in a large sample of a population, then those mutations are going to arise quicker, and it's going to be harder to identify them when they arise and adapt to those mutations. So if it starts behaving differently, we may not be able to notice it because our contact tracing, all of it, is just pretty much shot once you get past a certain number. So the herd immunity strategy is quite literally one way that you can actually defeat the herd immunity strategy. If we get rapid mutations where we get strains where you can't use the same vaccines on them, now we're back at square one, all right? And finally, it won't save the economy. It's not going to help. And we know that because someone already tried it, okay? When Europe shut down, Sweden decided they wouldn't, okay? Sweden said, well, what we're going to do is we're going to trust that our people are going to be responsible. They're going to socially distance. They're going to wear masks. The old people are going to be locked away, and it's going to be fine. Well, that's not how humans act. We've seen it here. We've seen it around the world. You see these young people out in the park, all on top of each other, no mask. This is from a couple of weeks ago. Sweden tried this. They experimented on their own people, and it failed spectacularly, okay? So they literally gained nothing, okay? It's a self-inflicted wound, and they have no economic gains. Let me show you. Sweden has a COVID mortality rate 6 times higher than their neighbor Denmark. But here's the thing. Sweden's economic growth for this year is projected to shrink by 4.5%, a little bit more than Denmark's, where they went into hardcore lockdown, shutdown, contact tracing, the whole thing, okay? Sweden's unemployment rate actually increased more than Denmark's. And reduced consumer spending is about the same across countries. So Sweden literally gained nothing. They gained nothing but a pile of corpses. I'm sorry, but that's not a good public health plan. Okay, when your public health plan says the only benefit of this is that we get to bury more people, that's not a public health plan. So, I'm going to end with this quote. In light of these findings, any proposed approach to achieve herd immunity through natural infection is not only highly unethical, but also unachievable, okay? And this is from the 2 doctors who have been looking at antibody retention in Europe, in Spain and Italy, where they were hit very hard. And they're saying herd immunity is, no, it's not a thing that can happen. So, thanks for watching. I hope that helps. And I just, I don't think the herd immunity strategy is convincing. I really don't think so. So.